Yeah, this is this is a very common question.
Wish I had a tail, wish I had a tail. 'Cause if I didn't, I would swing it, be swinging it in front of you.
The second question is a question we hear a lot of times. What kind of membrane do you recommend?
We usually use for common procedures resorbable ones.
Yeah,
And
it's for sinus lifting.
are you asking? Yeah.
It's only for sinus lifting today.
Then you have to use, of course, a resorbable
You
one.
can't use anything else. But I think there's not a big difference in between the membranes for sinus lifting, and has to stay for about 6 or 8 weeks at least. And then you can use almost everything. Don't use a PDFE membrane.
Yeah, of course, you have to use a resorbable one.
How do you manage massive arterial bleeding? Did you have it already?
Yes. I have it several times, not very often, but there's arteria sometimes crossing directly in this area where you want to create your window for sinus lifting. And this is sometimes not so easy because this arteria runs not only into the bone, only it has a contact to the Schneiderian membrane. And the stop of bleeding goes ahead very often with a rupture of the membrane. And then you have to try to compress it with a clamp, whatever.
So compression? It's always compression.
Compression.
If you have bleeding. And we have a bipolar system to heat it up. But of course it's difficult if the vessel is inside the bone. And if you have really very strong problems and nothing helps, then you have to make a compression with a tamponade. I don't know the English word. You have to fill up the sinus with a gase or something like that, and you have to fill in 1 meter.
But to be honest, this I never have,
No.
And I make thousands of sinus liftings. Very, very rare, very seldom. Please don't be afraid because of this complication. This is very seldom.
What if the graft simply does not work?
The graft.
The graft.
The graft should work if you do everything in the right way, because the sinus lifting is the most safe procedure, augmentation procedure in dental implantology, because you have a very quiet area, and if it's surrounded by membrane and your bone graft material is in a very quiet place, it will heal for 100% sure. Very seldom we have an infection. I had recently a patient, obviously there was an infection in the sinus. It was very obviously on the X-ray that there was no reorganization from the graft. And then you have to remove, of course, everything and start from the beginning.
That's what I think too. It's a very safe indication for augmentation, sinus lifting, and you can put almost everything into the sinus, bovine substitute, autogenous or allograft, Chinese noodles,
Rice, potatoes,
Tabasco,
and a little bit tomato ketchup.
Everything will get bone if you do it the right way. But I think there are two things you have to be clear about. You have to push the bone graft to the bottom of the sinus. Don't push it somewhere inside. It must be in contact to the bone. Then you have to fill up the sinus and push it inside the sinus to the bottom. That's complication number one if you don't do it. And the second thing is if you do a simultaneous implantation and the implant has some mobility and it moves inside the sinus, then it could be that you get only
Then it doesn't
soft
work.
tissue.
This is a biological rule, something what moves can't get bone. But we have so many options to get a primary stability even in very, very small sinus flaws. We very, very, very seldom do two-step surgeries for sinus lifting.
I've heard that the bone ring technique should be nice for that. You should make a video about it.
He's a funny guy.
Man with a gift and I'm doing my shit like
What medication do you prescribe the patient? Painkillers and antibiotics.
That's it.
Do you spray, nasal spray?
If someone has problems with breathing through a nose, then you can make some nose spray for anti-swelling.
I would say ibuprofen works.
Yeah.
Ibuprofen 600 milligrams. And antibiotics, almost amoxicillin in Germany. If the patient has penicillin, can't take penicillin, then clindamycin.
Yeah. Yeah. We like to describe amoxiclav as a combination of amoxicillin with clavulanol acid, and this has we have very good experience with that.
We don't get amoxicillin at the moment.
Yeah, I know, but amoxiclav we get.
What do you do if the sinus includes a irritation, cyst, or similar leak?
Cause if I didn't, I would swing it, be swinging it in front of you. If I had a tail, if I had a tail, yeah, if I didn't, I would swing it, be swinging it in front of you. I would swing it to the beat, I'd be a mover.